Before we jump into today's episode, I want to make an announcement. Capstone Leadership Solutions, which was co founded more than 14 years ago by two registered nurses, we're getting back to our roots by offering a nursing excellence event. We know that every rural hospital wants to promise and provide exceptional nursing care. But nursing excellence doesn't just happen because some nurses are great. It happens when every caregiver delivers consistent, evidence based care, every patient, every shift, every day. So we hope you will join us on August 11th at 12 p.m. Eastern Time for a free webinar where we'll be overviewing the same proven 5-step approach. We call it the Capstone Adoption Method that we've used to help rural hospitals improve patient experience, strengthen teamwork, increase consistency, and create nursing improvements that take hold and last. This webinar is free. Again, it's on August 11th at 12 p.m. Eastern Time. And you can go to our website, capstoneleadership.net, and go to our resources page where we have all of our upcoming events listed. Or you can email us at info, I-N-F-O, at capstoneleadership.net, and we can email you the registration link. Now on to today's episode. I think the smaller you are as an organization, one, it is easier to be helped by innovation, but it's also easier to be hurt by not innovating. Welcome to Culture Change RX, the podcast for healthcare professionals that are committed to creating a thriving workplace culture, improving the experiences of employees and patients, and ultimately unlocking their organization's next level of potential. I'm Sue Tetzloff, your host and co-founder of Capstone Leadership Solutions. Join me and my insightful guests each week as we share actionable insights for navigating the crucial people side of the business of healthcare. Subscribe now for a weekly dose of Culture Change RX. Now let's dive into this week's conversation where culture change takes center stage. Welcome to another episode of Culture Change RX. It is me, Sue Tetzloff, co-founder of Capstone Leadership Solutions and the host of Culture Change RX. Today is one of those episodes, those weekly episodes where I have a guest in the studio. We always start when we have a guest to have them introduce themselves, and then we get into our topic of the day for this episode. So first with the introduction, welcome, Mark.
I'm Mark Allen. I'm the founder of Rural Health Engine, currently located in southern New Hampshire. Rural Health Engine, we are, among other things, but we're kind of a specialized, unique technology consulting group. I actually prefer to think of us as, innovation liaisons. A very deep and broad history with innovation, innovative technologies, spans across numerous industries, but predominantly within healthcare. I formed Rural Health Engine. It's it's newly formed nonprofit. My goal was to ultimately take, these 15 years of experience in understanding innovation, knowing where to find certain capabilities, certain companies, and then turning it around and bringing them into markets that are in the most need. And that's ultimately why I formed this was when we first got into the rural sector, it was abundantly clear that a lot of people knew the problems. I mean, they knew the problems with health outcomes, but it didn't seem that many people understood how to solve those. When we were, again, just talking, kind of went state to state to state and just showcasing, well, here, these are some innovative solutions that we know about. And it was almost just ubiquitous. It's like, holy cow, I didn't know that kind of capability existed. When we were first kind of dipping our toe in the water, that was a common theme. So we fully transitioned into the rural sector. We've been doing this for over 4 years now, totally dedicated to it. But my goal is to truly be a resource for the rural communities, so rural hospitals and clinics, and also governments and associations to really kind of take the veil off and understand what is out there. Because for us, we have always worked with, I'll call it earlier stage technologies, not hard startups, but companies that are just not mainstream. And in the rural sector, I hear it constantly. Everyone knows the bigs, your ECWs, your Epics and everything else like that. But it's easy to understand that the terms rural and innovation don't go together very often. So most people just aren't aware of what's out there. And for me, that's been my entire career is learning about all these really cool new ways. They're just better, faster, cheaper than what's out there. These solutions that have really outstanding capabilities can be of significant value. They actually provide way more value to the rural sector than they do in the urban areas. But also these are the kind of companies who don't know anything about rural. So we like to be that conduit between that. So that's really our mission is to be, a no cost resource for rural hospitals to bring them solutions that will fit their greatest needs.
Wow, almost like a connector of sorts of, yeah, you're right. They understand the problems. They just don't even know that solutions might be already readily available to them.
Mhm.
And you know about the solutions and to connect them with that. I know from meeting you is that you have a background in the Coast Guard. And it's interesting that, here about FACE, you have a nonprofit for rural health care for innovation. So I'm just wondering about the story of making that transition and what they have to do with each other, if anything.
Yeah, well, I mean, we always had the best stuff, available. Our huge budget in the Coast Guard, we had all these cool technologies. I mean, the very opposite is true. But a little bit before that, though, I was born and raised in right in the middle of Missouri, very small town. So I grew up rural. I know firsthand what it's like to have to drive an hour to see a
Mm.
doctor. But then out of high school, so joined the Coast Guard, graduated the Coast Guard Academy in New London, Connecticut. And for all those naysayers out there, it's the exact same thing as the Naval Academy, as West Point. We even have exchange programs where the cadets go back and forth. So spent 9 years in the Coast Guard, some of the greatest times of my life. And I can actually, I mean, without question, say it was probably one of the best decisions of my life.
Mm.
And the amount of stories, the amount of leadership opportunities, it was just fantastic. I mean, if there are any parents out there that are questioning maybe what their children should do or if they're going into college or something like that, I highly recommend it. It's one of the most amazing branches, I think, with such a broad spectrum of missions. I served on a ship. I've been out in the high seas. I did search and rescue. Went down. I've arrested drug smugglers. Did migraine interdiction. I've done personal, our waterborne security for the president, nuclear
Wow.
submarine escorts. I deployed everywhere. I have so many cool experiences, jumping out of
Yeah.
helicopters and all that stuff. But the transition was almost, accidental. That's the life of, an entrepreneur is you kind of just go where the
Hmm.
wind blows.
True.
But I've always been a real advocate of solving problems or thinking outside the box to solve problems. And it just so happens again, all the innovators, that's where they are. And that's why I love, that early stage technology community. They're just people trying to solve problems. Again, kind of accidental, but it was following a passion that in gravitating towards things that I wanted to do because
Hmm.
large companies, big corporations, they're really not trying to solve problems. They're trying to stomp out competition and survive and things like that. So
Hmm.
that's kind of how I went into it. I do owe, a big thank you to my previous partner. Unfortunately, passed away, but he really helped me and led me into that area as well.
Hmm. Yeah. Very purposeful work. I mean, like it seems like
Mhm.
your life's work is whether it was in the Coast Guard or what you've been doing in these, years following that has really been purpose driven, meaningful work. And it's cool that it's focused on rural healthcare as well. And that's your roots. I know from my work in rural healthcare for 30 some years now is that I think it's always been true that it's always been challenging, but it seems like we're at a different critical point now in rural healthcare with, the potential, the amount of closures and the fragility of a lot of organizations and how that's impacting the staff, how that's impacting the community members, the strength or not of their local rural healthcare organization. And so a lot of problems to be solved and a lot of innovation to be had. So when you're working with, let's say, a healthcare organization, how do you even begin to understand what might be what they need to help them into the future, be more stable, even thrive, be innovative. Like, what does that process look like? How does your thinking work? How do you
Sure.
help them?
Just like with anything, I always tend to ask a lot of questions. And it's always been surprising to me just what some of those answers are. One of the big kind of revelations I saw, and not in a good way though, was just how antiquated so many systems are in the rural communities and rural hospitals. And so that's led me to really bump my questions back and kind of take a different angle at it and really get down to the bare bones of, well, talk to me about your operations. Are you actually doing this? I mean, and again, I'm not surprised anymore, but I mean, so many are still using Google Docs, Excel spreadsheets, handwritten bulletins, and on the bulletin board. And it's just like, man, I just assumed that people were kind of keeping up with new stuff, and it's not. So that's where I always start is just, let's talk about what's going on. And then I always kind of go into, all right, well, what's the plan for the future? How do you plan on fixing this? And then my big question is, are you even aware of particular solutions that could help in this area, this area, this area? And most of the time it's no. And that was also, a big reason why I started Rural Health Engine was I would go to these conferences and, you see 35 different vendors and I'd be talking to a hospital, member and they'd be looking at all these things and just, well, I don't know what agentic AI is, and we've always done the coding and billing manually, or I don't want ambient note taking. So there was so much of what, they don't know what they don't know. And so a lot of that is me just kind of piecing it together. It's like, well, did you know you can kind of automate this process? So a big part of it is literally just helping them discover what's available. I did a webinar several months ago, and we actually did a survey among a bunch of smaller hospitals. We asked the question, why haven't you adopted, new tech, AI things? And it was amazing. It was like 40, 50% were just didn't know about it, didn't know how it would fit in, didn't know the capability. They've just totally unfamiliar grounds. So a lot of my discussions is just showcasing, hey, these solutions are out there. Not only are they out there, I have found they are remarkably easy to implement. We're not talking about overhauling your entire EHR system. A lot of these things can be done with pilots. You can dip your toe in the water. You can maybe just take a couple physicians and say, hey, you try this kind of thing. And the value add is so great. I mean, it could be 10x ROI. That's a lot of how the conversations go. And I have to constantly say that I am not pushing product because ever since the RHTP, everyone's getting that. Everyone's knocking on their door now, trying to grab a piece of the pie. That's not my role. I just happen to know a lot of companies who we personally vet who I think would be applicable. I definitely don't I try not to make it sound like a sales pitch. I just get very excited about these solutions and how they can help.
Yeah. When you mentioned that some of these innovations that are out there and available to other businesses or bigger healthcare organizations that could be beneficial to rural healthcare organizations is that, you mentioned that it wouldn't take a big overhaul. It wouldn't be possibly really hard to do. And I found that to be true is that I find that, we work with healthcare organizations to help transform, in particular, their employee and patient experience. And that's much harder to do in a big, huge organization with thousands of employees and all of the processes and people and the behaviors involved with that. Where when you're talking about a contained smaller organization, innovation, behavior changes, process changes, I just think they're faster and easier. You just have to know what they are and, why you should do them. And the how and the getting it done is actually a bit easier than a bigger organization.
And not only that, it's far more needed, I think. Because of, again, when you're manually entering billing codes, I mean, holy cow, not only is it much slower, but you can miss a lot. And you have to think about the real challenges facing rural hospitals nowadays. And typically top of the list is financial. so much revenue leakage, so much, loss in revenue, high cost. It seems to be kind of an unwinnable battle, and it definitely will be if nothing changes. But these are things that just can really they're honestly just tools. That's how I look at them. It's like going from
Mm-hmm.
the manual hammer to the nail gun.
Mm-hmm.
They just help your productivity be so much better. And with the AI stuff in particular, oh my gosh, I didn't come from healthcare, and it blows my mind that these incredibly smart, talented physicians are spending 4 hours a day manually putting in notes. That boggles my mind. And I was like, wow, we
Mm-hmm.
can just clear that up and let you do what you need to do, and that's care for people.
And there's technology for that. Yeah. Yeah. My husband is a family practitioner. Well, just recently retired after 43 years. And one thing that I always marveled at with him in rural healthcare was he wanted to be the one always to go first with technology. Like anytime,
Right.
even when the electronic health record came out, but anything beyond that, he would always say, let me go first. Cause he's like, it's coming anyway. I might as well go first, get all the extra help, have a say in it kind of thing. He's retired now and he still goes to training on AI and its application. And he's not even practicing anymore, but he's fascinated. I love that
That's
about
great.
him. Yeah. You hear this a lot in business that if you're not growing, you're dying. If you're not innovating, you're dying. I think the smaller you are as an organization, one, it is easier to be helped by innovation, but it's also easier to be hurt by not innovating. I don't know what your
That
take on
is
that would be, but I feel like I just did this exercise with an organization out in Washington where we had their leaders describe what wildly successful looked like in the future and what metrics would define that, what subjective descriptions would define this wildly successful future of their organization, and what would be the pathway to get there. Then I had them do wildly unsuccessful. What would that look like? And then what would cause that to happen? What would you do or not do that would get you there? And interestingly, the observation that one leader made was it's a fine line between being on the path to wildly successful or wildly unsuccessful. Like there's not a big difference. Like each next step is critical. Is it in this direction or that direction? And so I know that sometimes you even referred to yourself in a conversation earlier about being Mr. Innovation. I think that wildly successful is really about staying innovative and changing and growing. Like even we have them talk about if we only maintain the status quo, what would that look like? And we all know that that might as well be wildly unsuccessful is to maintain. So it really is about growing, innovating, changing, and technology and innovation that's the name of the game. I mean, really.
it is, and I mean, you hit the nail on the head. And it's so funny to so many people just so many leaders, organizational leaders, aren't used to being asked, well, what if you do nothing? Everyone wants to talk about what's the consequences of doing something. And I always love throwing that in there is, well, what happens if you don't do it? And it's just amazing how it just doesn't even cross people's mind.
Mm-hmm.
That's honestly what I mean. I definitely want to make it clear that I'm all things innovation, but I am not, I don't have a big background in tech coding or anything like that. I'm not a super geek about this kind of stuff. The majority of my, career has been about actually growing companies, in the private sector. And so it's far more business oriented. I just understand how to take innovation and make it applicable to a market, or help the market understand how it's applicable and their benefits. But in doing so, literally hundreds of like firsthand examples of understanding what makes a company successful and not. And I've seen so many failures throughout the years. Everyone's seen these too, just in public. Does everyone remember Kodak and Blockbuster Video and things like that? These
Yeah.
are companies who never answer that question. What if we do nothing? And
Mm-hmm.
they learned out that's what happens. And
Mm-hmm.
so I think it's actually it is so much more important and valid in the rural sector because, if a Blockbuster Video goes out of business, it's not going to impact our lives very much. A critical access hospital in the middle of Nebraska goes out of business.
Mm-hmm.
Well, geez, you're affecting the
Mm-hmm.
community, your employees. It's really
Housing
quite a
values, economic
oh gosh,
development, school system. I
right.
mean, yeah, huge. It is
And
huge.
that's a big, I don't know. And I always want to be humble in saying this because I've never ran a hospital. But again, I've worked with hundreds of companies and understand, the mechanics of making them successful. But I really think a lot of leadership, I mean, truly needs to look at it like a responsibility, a mission to the community. There's a memory I have that sticks with me. It's stuck with me for so long, but one of my very first search and rescue cases in the Coast Guard, it was this was the North Atlantic. This was the Georgia Banks, in like the perfect storm, 30-foot seas. I mean, it was
Just like a
chaotic.
movie.
It was much scarier than the movie. We're up on the bridge and with it was, me and Cap and the helmsman and the helmsman, young kid, just, he was rightful to say, he's like, what are we doing? This is nuts. And the captain just straight faced, just said, because this is what we signed up to do. This is our job. This is what we are here for.
Mm.
And I think that is really so applicable in the rural sector. If you want to go work at Mass General, you can do that. You can do that. But in the rural community, there's challenges, there's difficulties, but this is what we signed up for.
Mm-hmm.
And that's kind of what my passion is now, is I want to give you the best tools available and
Mm-hmm.
understanding and know-how to keep you there and to thrive. Because you said it, if you thrive, the community thrives.
Mm-hmm.
And I don't know, I think that should be at the top of a list of a lot of leadership of these hospitals.
Yeah. I'm wondering about the vendors or the folks out there that could provide these innovations to rural healthcare. I think back 22 years as a healthcare executive, I don't know, maybe I saw it wrong and I got a bad taste in my mouth from a few vendors, but I always got the sense from some vendors that as rural healthcare providers, we were kind of second fiddle to their big customers,
Right.
that they're giving us their leftovers. And if they had time for us, we got time, for support or help. And I guess I saw enough examples of that to start to believe that that was true. And it wasn't always true that we didn't get the best service, the best help from vendors. But I've really thought about this for vendors in healthcare that have innovative tools that could help small rural hospitals. Is I know they love to get the big contracts and the big dollars with the big guys, but I think they can get their best impact, purposeful work, meaning, and even best case studies and examples of it working maximally in a smaller contained environment. Like, it just seems like that might be what's in it for them to help the small guys is, just the purposeful impact of it and the success that they can have there in that environment. I don't know what you see, because, the companies that you
Yeah.
maybe are familiar with that are innovating out there, as a business, they too are running a business where revenue and clients and all of that matter. And sometimes going after the small clients doesn't seem like the right business solution. I don't know.
That's funny. And no, you're absolutely right. And in working with these earlier stage companies, yeah, I get that question a lot. The simple answer is that, well, you also have to understand there's probably, Washington State has, I think, 260 rural hospitals alone just in that state. Guess what? No one's knocking on their door.
Yeah. Yeah.
So
It's an
it's kind
untapped
of a wide
market.
open. Right.
Yeah.
As opposed to, again, like your Mass Generals, everyone's going for the big fish, the big whale.
Mm-hmm.
So that's kind of number one. But this is, again, why I would strongly suggest to any rural hospitals is really stay away from the bigs. It can be enticing, they can probably offer you maybe discounts, things like that, but it's going to cost you in the long run.
Mm-hmm.
You said it perfectly. I mean, you're a speck of dust on their radar. They'll be like, well, maybe we'll get to you next week to help you out. Whereas, the earlier stage companies, I mean, you are like their treasure. They can't have a bad reputation, things like
Mm-hmm.
that. So
Yeah.
if something goes down at 3 a.m., they'll be right there to support you.
Mm-hmm.
But not only that, too. I mean, I've seen all this stuff kind of firsthand, and everybody's used the big stuff, the Epic, even Microsoft, and
Mm-hmm.
we're just so used to it that we're like, okay, well, everyone else has this, all right, but just turn the corner here, and holy cow, you have no idea how much better stuff is out there, and not to mention too, faster, cheaper. It has so
Mm-hmm.
many more benefits. Not only are you getting a better product, but the support, the training, you are getting a better relationship than you
Mm-hmm.
would with the bigs.
We like relationships in rural healthcare, don't we?
That's exactly right.
We like to feel like we're in a partnership, like we're really in it together, like we're really aligned and in it together with our vendors, with our staff, with our community. It's very relationship based for sure.
Mhm.
Would there be an example, Mark, of like a certain technology or innovation that you think is like really ripe right now for rural healthcare?
I could go on for a long time because I would say this. Number one is anything AI in that realm of your operations. Again, the coding, billing, the patient management, that stuff. There's a lot of solutions out there, and I have several to kind
Mm-hmm.
of recommend in that.
Mm-hmm.
But outside of that, there's actually so many extremely simple solutions out there. So I will talk about this company because this is
Yeah.
this is a world I didn't know about before 2-3 months
Okay.
ago, and that's this care coordination stuff. It seems very simple, and you go to a website, and whether they have transportation services or a food pantry or coordinate between a doctor or something like that. We've all seen those, and they talk about it, nice big blurb, and say we offer this. And then it says here, contact Nancy and or call this number or this email or whatever it might be. And then you do that and you request this. And again, in my silly mind, I thought that they had kind of a efficient system. And no, they take that, they send the email off to the provider. Maybe they put it into an Excel spreadsheet. Maybe they manage it somehow, but it's completely manual. And so this company WellCheck, who I've gotten to know, and they impress me more and more and more. But their solution is so easily implemented, and it automates these things. You want to schedule a service or something for
Mm-hmm.
you can just pick one. Now, you have a website to go to, and the user now finds things faster. They can schedule it. Everything gets done more efficiently. Poor Nancy doesn't have to hope things get done and then tracks it, and then things, hope things don't get lost, and then also try to show numbers at the end of the year like, hey, we helped this many people. That's the other best part about it, is the recording
Mm-hmm.
and tracking. Because now when it's automated, well, now you know exactly who the person is, you know exactly where the care went, and you know how many times they've used it, and you can show those numbers in a big way. Like, oh no, here we helped 157 people this month, to
Mm.
get to this service. That was a 57% increase from last month or
Wow.
last year, whatever it might be. And it's that ability to track and record is such a benefit for
Mm-hmm.
so many of these groups. And I guarantee you, if you're, a nonprofit or an AHEC even
Oh
hospitals
yeah.
must go through this as well. I guarantee you probably understand what I'm talking about.
Yeah.
And they have the ability to completely digitize this directory, all the information, and holy cow, their case studies, their past performance has been spectacular. And this is why we really like them, is that they work within rural, they work with nonprofits, FQHCs, AHECs, and so they're very accustomed to understanding that world and working within
Mm-hmm.
grants and things like that. So
Mm-hmm.
I would highly recommend looking at them, called WellCheck. So that's just one example that
That's a
is something
great
that can
example. Yeah.
create
Yeah.
immediate
I can
value.
picture that manual
Uh,
process and that spreadsheet right now. I really can. I can sense that lots of places throughout our country, and that's great. As we get ready to wrap up with this episode, and I'm going to have you back because I just know
sure.
there's a million more examples and things that we can talk about related to innovation and strategic growth, and really helping healthcare organizations create a bigger, better future for themselves. And we don't want them to go down that path of wildly unsuccessful. And innovation is a pathway forward to a better future for them, and hopefully a stable future. But as far as how to reach you and how to reach out to your company for organizations that are saying, yeah, we are ready to innovate, we do need help understanding what's available to us to help us get ahead in this way, how can they find you? How can they find Rural Health Engine? Go
Okay.
ahead, and we'll put it in the show notes too, but go ahead and tell them
Sure.
how to reach you.
Website is ruralhealthengine.org. My name is Mark Allen. Email mallen@ruralhealthengine.org. And we actually also, we do, if you even want to kick the process off, we actually have a link to a readiness assessment. So you want to plug in a few
Oh,
things. Let's talk about what's your organization and your EHR system or things like that. We have just some kind of basic questions. And from that, we can kind of dive right into, well, here, this is how we can help. So honestly, that's why I'm here. And that's
perfect.
that's the
Yeah.
biggest thing I've been trying to say is like, just let me be your lifeline. Let me help. That's what I'm here to do. It's not going to
Yeah.
cost you a dime. I'm not making anything from this. So let me fulfill the mission and give you a hand.
That's fantastic. Yeah, definitely. I'll put all that information into the show notes. And sounds like that inventory or assessment is a great place to start. So, yeah. Well, thanks for being here, Mark. We really appreciate what you're doing for rural health. And I'm so glad that smart, innovative people like you are on the team of helping rural healthcare. It's a passion of ours at Capstone, and I see that passion in you too. So thanks for being part of that.
My pleasure, Sue, and thank you very much for having me.
Thanks for tuning in to Culture Change RX. If you found value in today's episode and you are a believer in fostering change in healthcare, join us in making a difference. Follow, rate, and review our podcast on your favorite platform. Share it with colleagues and your network. Together, we can make a lasting impact. Until next week, keep inspiring positive change.